We have a number of, particularly of retired consultants who come into us in Vincent's and they come in for their CPD. But if you talk to people, you may be still involved in some element, even peripherally, of clinical practice. And one example is doing medical legal reports or some such thing. And therefore you can audit your turnaround on medical legal reports. Because again, that's your practice and it's improving patient care. If you're, the farther away you get from practice, the more difficult it does become. But again, any element that you are involved from the practice point of view, if you're doing a locum somewhere in a practice and you're only going to be there for a week, you can audit within that week. Because again, if you have something simple that you do, like we'll say in general practice, those patients that come in who have like having their blood pressure measured each time they arrive or within the last 6 months. Or any of the diabetics who come in, have they been seen for fundoscopy in the last year? And that's a simple question. You just ask them and see how do they reach that standard. And then you say, well, then from a practice point of view, as opposed to you personally, do you need to change the behaviour of the practice? From people who are farther out, it does become more challenging. And this, from an official council point of view, there is always the option of you withdrawing your name from the register. It doesn't mean you have to stop calling yourself doctor, but it does mean that you're not able to prescribe and fulfill all those duties. But it's an issue that's going to be facing us, and we have to acknowledge that. But if you are retired or not in practice, even have you been to have an update on your basic life support skills or CPR training in the last year? You could audit that.
The other thing as well, I think I'm right, and correct me if I'm wrong, that for people who are well removed from clinical coalface, it is a big challenge. And certainly the GMC, and I think the Medical Council, is also open to the idea of a quality improvement project. So if you go back to Ian's very first slide with the PDCA, so if there is something relating to whatever sort of work you're doing that makes you want to be still on the register and needs to still be on the register, then you can develop and design a project following very much the same principles, and I think that would probably be acceptable. And then I suppose that ultimately, if you're not doing anything that allows you to do any of this, then maybe you have to say, why am I persisting? And that's a difficult question.
The one going back to the retired people that we have, again, your local hospital, and again, think laterally. If you say, I'm well out of practice, and your local, be it local GP practice or local hospital, you march into them and say, is there any audit I could participate in here? I bet you they'll say, yeah, please come in, because there's organisational requirements for audit as well.